Hey, Corey.
What's up, Dr. Lil?
How are you?
What's going on?
Not much, just staying busy, you know. How about
Listen.
you?
Listen, first of all, let's talk about these shoes
Ooh.
because I'm doing good with the shoes.
Come on.
Look at the shoes.
Women in their shoes.
Women in their shoes, they look great.
You know, thank you. They're actually a lot more comfortable than they look because they're platforms.
Okay.
We can definitely walk on
Yeah,
platforms.
so these you can go out and walk.
Yeah,
and not
these
be
are party
uncomfortable.
shoes. Let's go
Party shoes.
dancing.
Ah, okay. We need a bariatric ball for that. Come on.
Hey.
We need to come up with
That
that.
sounds good.
Yeah.
Bariatric ball.
Bariatric
I like
ball
that.
here in the States. Yeah.
All right, let's do it.
All right.
Yeah,
Coming
put
soon.
that-
We'll
coming
be
soon.
planning it.
Bariatric ball. A gala.
Right? I got
I
it.
love it.
Exactly.
I love it. Love it. Love it.
Yeah.
But it's nice to see you. I know that you've been really busy too, just
Yeah,
with work,
just
with podcasting and
everything.
life.
Yeah,
Yeah, that's
yeah.
good. That's
Yeah,
good.
and always gonna make time for our podcast.
Love it.
This is our baby.
Yes.
So
yes.
we're just here to sprinkle it and watch it grow.
Love it. Love it. And
And-
I like to garden, so
Yeah, see,
I have a green thumb.
perfect.
Yes,
Perfect.
I do. Yes.
Oh,
I
that'll
do.
be a different podcast where you'll tell them about your
Oh,
entire garden
yeah.
and all the veggies.
Yeah,
and
maybe
fruits
I'll invite you
grow.
over to my house. What do you
Come
think?
on, listen, we can make some videos, right?
That sounds fun.
Okay.
That sounds like a lot of fun.
And I get free food, guys.
Yeah, there you go. It's mango season in
Mango's
Florida.
my favorite.
Yeah, well,
Yep.
I froze like 5 bags.
Yeah.
Yes.
Oh,
And
that
I
means
still
I'm
have
coming over to
more.
get a bag, Doctor.
Yeah, it's crazy.
Okay.
Mm-hmm.
I'm definitely gonna take her up on the invite.
Absolutely. You're always welcome. You're always welcome.
So they say that a big topic, after bariatric surgery is a lot of people are gaining weight, right? They're talking about this weight recurrence.
Right. Right.
And people really want to know why is it coming on so fast?
Right.
What can they do to stop it?
Right.
What are your thoughts on the whole weight recurrence?
Yeah, I have a lot of thoughts on weight recurrence, but
Okay.
my question to you first is,
Mm-hmm.
did you have some weight rebound?
It's only been like 2 or 3 pounds.
Okay.
Per se. So it's like from like 200 to 203, and then I'll go down to like 197, and then go back up to 200.
Right.
And then I kind of just stay there.
Right.
Right. But I did notice once I start losing, I do lose my strength. I do tend to notice it. Yeah.
Yeah.
But I do enjoy being much, much lighter though.
Right.
I do
Well,
enjoy
I know we've had conversation about it. Like, what's an ideal body weight,
Yeah.
Because everybody's
Yeah.
really focused on a number on a scale,
Mm-hmm.
But I'm always like, it's all about the body composition,
100%.
right? And I know that, you work out,
Yeah.
so that's really good. But I had asked that question because I know you also had a surgery and you couldn't do a lot of workout, right?
Yep,
Is
yep.
that when you rebounded with the weight?
Surprisingly, I didn't. Not too
that's interesting.
much.
Wow.
I mean, I've gained, I think it was like 7 or 8 pounds. But then once I got back in the gym, because you know me, I'm like a gym freak.
know,
I was
love
back
that.
to my twice a day,
Wow. I love
and the
that.
weight came off in
Yeah.
like 2 days.
Wow.
Yeah.
Wow.
And I don't know if I just was motivated to just get it off. I
Right.
think because I felt myself, not that I was, big per se, but I
Right.
just felt like not like my normal self.
Yeah, you felt it
And
already.
Yeah.
Wow,
yeah.
interesting.
Yeah,
Interesting.
and then too, I think because it came on kind of fast,
Right.
like 7 or 8 pounds in 3 weeks.
Was it water weight though? I mean, did
Yeah,
you
it was-
change
it
your
was-
diet
no, it
during the
was-
recovery?
It happened to be mostly water weight
Water weight.
because once I was sweating back to my running
Right,
again, the
right.
weight just flew off.
Wow, that's really good.
So yeah,
Really, really good.
yeah.
Well, I can tell you it is a hot topic. And I remember I did a support group once, and I'll never forget it. This must have been, 15 years ago. Yeah, I've been in the field for a long time, as you guys know. And I did a support group, and I started out, maybe I shouldn't have done this. I started out by saying, all right, everybody has metabolic and bariatric surgery here, right? They're like, yeah. I go, that's awesome. But did you know that weight recurrence is inevitable?
Wow.
They're like, what? How could you say that to us? What? And then I realized, all right, I have to continue with my sentence.
Right.
So remember, from a physiological standpoint, when your body loses weight, your body kind of sabotages that. It wants you to regain that weight because it doesn't realize that you're telling it to lose weight. So it's trying to protect you. So it's a physiological adaptation that when you lose weight, you're going to gain weight.
Right.
So will everybody with metabolic and bariatric surgery gain a little weight? Like you might go up and down, up and down? The answer is yes. I mean, I've been in the field for over 25 years. It doesn't mean that the weight that you're regaining is a bad weight, right?
Right.
You gain some weight, You got it off, you're kind of fluctuating within a certain range. It's called a set point, right?
Yeah.
Body has a genetic set point. So always think about, and we'll talk more about this, always think about a weight range, not a weight on a scale, first of all, right? Because, yeah, as you get older, things are going to change. There really are things that are out of your control. Hormones, age, you know. I certainly have a harder time losing weight now in my, I won't tell you how old I am, but in my stage of life than when I was your age, obviously, because my muscles are different, my hormones are different, etc. It doesn't mean be upset about that. It means you got to manage it. It's called weight management for a reason, right? So when you do recur some weight back, you have to say to yourself, what was under my control? Was it because I couldn't work out because I just had a surgery? Yeah, okay. That at the time was not in your control. You couldn't exercise, but then you got right back on.
Right.
I'll have some patients come back to me in the clinic and they've regained maybe 30 to 50 pounds back. Rarely will I find somebody regain all their weight back. I can tell you that's one of those bariatric myths. You know, I'll have people that'll make, you know, ignorant comments, not patients with bariatrics, patients without bariatrics, saying, oh, what a waste of a surgery. Why get the surgery? You're going to regain all the weight back anyway. It's a failed surgery. Seriously,
crazy.
Can you get your facts straight, please?
Right.
You know, I can throw out a bunch of statistics, but I won't. I can just tell you from practice, it is extremely rare for somebody to regain all of it back. Now, I'm not saying that they don't regain back weight that actually hurts their health. I have seen that. But you have to say to yourself, what out of that was in my control and what maybe was a little bit out of my control? You know, maybe there was a new medication. It's not an excuse, you guys. There are medications that cause weight gain or weight recurrence.
Right.
There's surgeries. There's stress hormones. There are lack of hormones like me in my stage of life. So those things I can't really control. Genetics, I can't control that. But what is it that I can control? Well, I can control my diet. I can control my exercise. I can try to control my stress. Right? So lots of things. So do you have a weight range in mind? Like are you happy at your weight now?
I'm happy, but I know I could lose more.
Well, let me ask you a question. So that's going to segue into another question. Are you looking at a number on a scale?
No, I'm mainly going for like the body comp. So that's why
So
now
explain to me about body composition.
So for the body composition, so even prior to this, when I did the whole DEXA scan and got that done and got my body fat, and before when I was in the 30s, so my
Was
biggest,
that your highest?
No, my highest was I think had to be in the 50s. I think
Your
like
body fat was
50
in the 50s.
Yeah, it was like most of my weight was just all fat, and I think. I forgot what the exact number was, but it was close to normal or in the like considered normal range. And then now, since just at home, I'll like check every couple of weeks just to see how it's doing.
Right.
And now it's gone down even more.
Wow.
Actually, I went to the outlets and just was like trying on different shirts.
Right.
And usually I'm an extra large.
Right.
The extra large shirts are all big on me now. So now I'm down to a large shirt and large pants.
Wow.
So
you are changing your body composition.
I'm changing, yeah. So even now, like I had to change my belt so the pants could fit because all my 36s are getting big on me now.
That's
so
awesome.
it's just, to me, now I really don't care about the number. I just
Like
want
the
to be
weight
able to,
number.
yeah,
It's
like
just the total weight.
the total weight.
Do you want to tell us how much you weigh?
So right now, I'm currently 200 pounds.
200 pounds.
200 pounds
Okay.
flat. But I definitely wanted to get to 180, only because I've never been that small in my life.
I know we've had
And I just-
conversations about
I
that
mean,
because
yeah.
you'll throw out that number. I'm
I
like,
know.
where did you even get that number from?
I just feel like another 20 pounds would just bring in my stomach. Because I know to other people, it seems like I don't have one, but I feel it. Like,
Is it
I
skin?
see it in clothes. Yeah. Most of it is skin.
Okay, so how do you get rid of your skin? You can't do
Which,
that through your
Obviously,
exercise,
I know.
right?
Right. But
See, that's another thing. You brought up a really big topic.
Mm-hmm.
You know, if you want to try to get to 180 and you're trying to do that, is that going to be at the sacrifice of your muscle,
that too.
right? Because skin is heavy, and if you do have some skin, you know, that's going to weigh, obviously, on the scale.
Exactly.
So, again, you have to
Exactly.
keep those numbers realistic.
Right. I don't know. I think I just want to see, and also because I really wanted to see if I can get a little bit leaner.
Okay, so how are you going to gauge that?
Right.
What number are you going to look at? I'm
Well,
leading. It's a leading
no,
question,
yeah,
Corey.
true. You know, at that point, I think, you know, people say, oh, if you just lose like an extra 10, 15 pounds, then you're going to get leaner, of course,
Right.
because everything's going to start showing more because you have less body fat.
Right.
So I guess I'm just going to gauge it to see. But I think at some point, I'm not going to have a number. I think I'm just going to be like, oh, you know what? I dropped 15 pounds. Cool. I think I'm happy. Because I still can do everything now, like
Right.
play sports, can be active.
Yeah.
I'm still going to the gym twice a day. So I still feel like this is my best shape I've been in. Even like,
Well, are you looking at your body fat number? Is that where you're trying to shave it off of?
not really. I think.
Okay, well, why? I guess that's why I'm asking.
Oh,
that was
you're
my
asking me-
leading question.
That was leading. Oh,
Yeah.
I don't think I was leveraging the body fat number.
Are you at a normal body fat?
Yes, I
Okay.
haven't.
So do you want to get leaner because you want to get rid of more body fat?
I think I just want to get rid of more body fat. I think because I
Am
can
I putting
see-
words in your mouth?
No. It's so true though. Only because of how I'm trying to structure it now. Because I've even seen some of the bariatric athletes.
Yeah.
Even they're doing their body recomp journey.
Right.
And they're looking very lean. Like there's this one guy, I don't know his name, but he is like shredded as a bariatric person. But he's got his skin here.
Right.
But it's like very minimal. Like you
Right.
really can't see it.
Right.
But he's shredded. Like everything on him just.
Right.
And I'm like, when I saw his before pictures
Yeah.
to now, I'm like, wow.
Okay, so it's his body fat that he's
So
getting
it's the
rid
body
of.
fat. He's just getting rid of that. So
Because remember, we all have ranges of body fat.
Yeah,
Like, so
yeah.
for women, obviously our ranges are going to be higher than men because
Mm-hmm.
women have greater body fat. And I can tell you that being Asian,
Mm-hmm.
Asians actually have higher body fat too.
really,
Yeah, just because of my ethnicity.
Mm.
And that's why that as an Asian, I have a greater risk of weight-related conditions at overweight, not obesity. Whereas with the Caucasians, it's obesity that increases the risk.
Mm-hmm.
Yeah, already if I'm overweight, I'm at risk at that same condition.
Wow.
Diabetes, hypertension, etc. So yeah, that's kind of a buzzkill for me, right?
yeah,
For sure. But if you're looking at, you know, body fat for me, for my age, anywhere the high range would be about 35%.
35.
Okay. So I don't want to go over 35%. So even if I'm 34, 33, 35, I'm in that range, then at least I know that from a body fat perspective that I'm within my range. So for you being a, you know, younger guy and you're a guy, your range is going to be a lot tighter. I don't know, was it 12 to 17%? It's
Yeah.
pretty tight.
Yeah.
So what a lot of bodybuilders would do, obviously, is to lean out by getting rid of some of that body fat. When you look
Right.
at some of these athletes and bodybuilders, they have 5% body fat,
It's crazy.
3%,
I don't know how they-
5%.
Yeah.
I mean, that's a lifestyle.
Yeah. That's a whole lifestyle change.
I mean, look,
That's-
you need body fat. You need
Yeah.
that's why there's a range. You need it for physiology. You need fat to absorb fat soluble vitamins.
Right.
Going back to the vitamin discussion, you need
Right.
fat to protect your organs. I mean, there's fat even behind your eye. There's fat in your ear.
Yeah.
Did you know that I've had patients lose weight so quickly
Mm-hmm.
that they lose the fat that holds the eustachian tube in place?
Really.
And that's in your ear, so their
Yeah.
tubes move. And then they have like tinnitus and ear pain.
Oh my gosh.
Yeah, so they actually
really?
lose weight there. And you know, you lose weight all over,
All
but
over,
you
yeah.
know, but even in your ear.
Really.
So that's why you brought it such a great topic about body composition. That's really what it's all about, body comp. And waist measurement.
Yes.
The fact that you're
waist.
under 40 inches is amazing from a physiological perspective. We get very excited because we're like, that decreases your risk of those weight-related conditions.
Yeah.
Right? Because,
Yeah.
I mean, come on, if you have a larger waist, you're holding visceral fat. What's there? Your heart, your kidneys, your
Right.
liver, your intestines.
Yeah. And
That's awesome.
and even just thinking about it, like it just shocks me because I'm like, my highest was like in the 50s, like a 52 almost, right?
Right,
And I'm
right.
at 36, about to be at 34 soon. And it's just like,
Yeah, that's pretty cool.
it's in only just a year and a couple months.
Right.
That's just crazy to me, you know?
But you know what? Bariatric surgery wasn't the easy way out. That gave you the tool,
No.
but you are working diligently and hard with that tool,
Yeah.
right?
Yeah.
I mean, you're going to the gym twice a day, which I'm always worried about. Because I'm
Yeah.
like, is that something you can sustain? I'm always challenging him. He's like,
Yeah,
can
she
you
always.
sustain that?
I know it's become part of my daily life now. It's just like a way
That's
of life.
just awesome.
Yeah.
What advice could you give somebody about that exercise? Because I know, we always have these excuses. Oh, I'm so busy. I've got work. I'm working 80 hours a week. I got kids. I got this. I got that. How do you fit it?
I think for me, I can say I was the king of excuses. I used to say the same thing. Oh, I have no time. I can't do it. I'm busy and this and that. And then once the gym became therapy for me, because obviously there's certain days you're not going to want to go. I still don't want to go on certain days. Like there's some days I'm like, oh my gosh, can I just sit here and burn calories? Sit at my desk,
Right.
But I don't know. It's just become a form of therapy for me. Even now, like we have very busy lives.
Right.
But you'll be amazed with that little hour, even sometimes 30 minutes. If you just
Right.
go in and do 30 minutes but take less breaks, just what 30 minutes could do for your mental state.
Yeah, I
Because
love that.
there's some days I really don't care about trying to lift super heavy or trying to do a full body workout. Some
Right.
days I'm just here for the mental aspect.
Love
It's been
that.
crazy at work. It's been crazy in my personal life.
Yeah.
I just need a moment to just put on some music and just get into a zone where I can just forget everything for 30 minutes.
Right.
And it changes the rest of my day.
Oh, that's
So
great.
I think treating it in that aspect has shifted my focus on, oh, okay, it's not just you're going to the gym to work
Right.
out. It's just like this is becoming a part of my lifestyle.
Mm-hmm.
And then to touch on that part, it also motivated me now going to the gym to now go get a certified personal trainer
Love that.
certification, which I plan on getting. So
That's great.
it's like everything just comes back full circle.
That's so
you
cool.
know?
That is just so cool.
I'm just so thankful for it.
But that's
Yeah.
good. That's good that you're looking at body composition, because when people do have that weight recurrence, that's still what I want you to look at. I want you to see, did you gain weight in muscle because you're
That
working
too.
out and that's why the scale went up, or is you truly increased your body fat?
Yeah.
Because that's so important. So some of these scales that we were talking about, I mean, they're available now. You can buy them on Amazon and different places. They're called BIA, bioelectrical impedance. It's not as accurate as DEXA. That's obviously
Yeah, DEXA's
very,
the
very
most
accurate.
accurate.
But it gives you a good idea. Rather than just stepping on a digital scale and it says 200 pounds, at least you'll know I'm this percentage of body fat, this percentage of muscle. So I always say to patients, the other thing that I really love, dogs, right? So fast cars and dogs. Those are my hobbies. So I'll ask my patients, what kind of body type do you like? Do you like the pit bull? Because I have a 4'11" woman that likes to power lift.
Wow.
And let me tell you, she is a pit bull.
Wow.
Her muscles are gorgeous. And then I have another patient, she's in her late 50s. She likes more of the Pilates, yoga. She's more of the greyhound body,
Okay.
right? She wants the long muscles. She doesn't want the bulky muscles. So, just looking at that body fat and looking at the muscle mass to see what kind of body type do you like. When I was younger, a lot younger, I had less muscle, but I liked that because I wanted to be slim because I was doing some modeling. So you wanted to have no muscles. You wanted to be
Right.
really thin. You wanted to be rail thin. That's not sexy to me now, being an older woman. I want to have more muscles. I want to be able to feel my muscles when I walk. Or if I'm, looking down at my bicep.
Yeah, there you
All
go.
right, yeah,
Come
all right,
on,
I'm
Dr.
covering my
Mel.
biceps right now. But that's what I want now.
Yeah,
So I think goals should change as you age as well,
that's true.
right?
That's true. And I think as you get older, you should prioritize muscle. I
Yeah.
think people see it as such a bad thing because they just want to be skinny. Everyone just wants to be snatched and be skinny, but
No.
it's like, no, you need muscle too.
Yeah.
You
Yeah,
know, it
that's
goes hand
that's
in hand.
And muscle keeps your metabolism going because remember, muscle is very metabolically active.
Right.
Here's a cool fact. There's something called a mitochondria. You probably heard about that, right? In
I did hear
Bio
about that.
101 when you were in high school.
Yeah.
So mitochondria is found in the different, muscles of your body. And they're really cool because when you build more muscle, you build more mitochondria, and that makes your metabolism stay revved up because mitochondria makes the energy. So how
Wow.
cool is that?
That's
I know,
awesome.
it's all right, the mighty mitochondria. Don't you remember that from school?
Yeah.
But how cool is that? Because you know that your metabolism kind of dips a little bit as you're losing weight. So you want to rev up your metabolism. You can do it temporarily, like with caffeine, right? That
Right.
temporarily gives you that rev. You know, you're just
Mm-hmm.
stepping on the gas, a little bit of that sports car,
Right.
but you want to keep it revved up, right? So you have to build muscle. And unfortunately, we lose muscle naturally through the aging process. As soon as you hit like 30 years old, you're losing a lot of muscle mass. I've read even studies that say up to 40%. I'm like, oh my
Wow.
goodness, that's a lot of muscle mass.
Wow.
So you have to maintain that muscle because we're losing it as we age.
So since so many people lose so much muscle, right?
Mm-hmm.
Is there any supplement you would recommend or like any foods that you think might help
Sure.
people to either maintain their muscle or to build
Yeah, it's
more
great. Well,
muscle?
first of all, exercise, right?
Mm-hmm.
Resistant exercises would be great.
Okay.
You know, I won't throw out numbers because that's more
Yeah.
individual,
Mm-hmm.
but I would look at protein, obviously, but carbs.
Right.
Carbs spare muscle. So
True.
if you're going to be on a 30 gram per day carb diet and expect to build muscle, you're not going to do it.
Right.
Then, of course, vitamin D is needed to build skeletal muscle, believe it or not.
Wow.
Omega 3s, that builds muscle, that helps to build muscle. Exercise, we said that. So I would look at the diet and I would look at different ratios of what people are eating based on their activity and then start to adjust the macros based on that.
Got it.
Okay.
Makes sense.
You obviously need iron because the more workout, the more blood that pumps into your muscles.
Mm-hmm.
So, you know, the body doesn't work in a silo, it's all related. So if you're missing, just say you're vitamin D deficient, you know, we see a condition is called sarcopenia. That's a medical condition where you really lost a lot of muscle mass and you actually have higher fat mass. There's actually something called sarcopenic obesity, where patients, I would almost categorize you as sarcopenic obesity back in the day because you were 50% fat.
Right.
So you didn't have that much muscle mass. You know, now you flip that, which is awesome. But vitamin D deficiency is so prevalent in the American population.
Right.
So you almost have to think, is that related to sarcopenic obesity? Maybe. I don't know if it's a cause and effect, but it's really interesting to see the two related.
Wow, that's a really
Yeah.
good fact, though.
Isn't that cool?
Wow.
So another reason to take your vitamins and get your labs tested too,
Yes.
because it's not just about protein. Everybody
Right.
just thinks it's protein. No, it's
Right.
not just about protein. You know, you got to eat carbs too.
Right. Yeah.
You know, so when somebody gains a lot of weight, you know, a lot meaning, okay, what does a lot mean? So if you were looking at the number on the scale or the number on the body fat composition, we clinicians worry about a 5 to 10% increase because we know statistically speaking, the more you gain in that percentage, the higher risk you have to get those weight related conditions. And if you already have history of diabetes, hypertension, sleep apnea, these things can come back,
Right.
right? They're already in your medical history. You just put them in remission. So we don't want that stuff to come back. So what do you think you would do? What would be your, I don't know, strategy if you saw, I let myself go a little bit, things happened in my life, I gained 10% back.
Right.
What would you do?
I think everything in life, people always say, let me just go back to the basics. I think, and I still
Love
kept that pamphlet of everything you gave me of like, okay, these are good foods and
Right.
this is what you should follow. I think I would legit just go back to the basics.
Love
Like,
that.
okay,
Bariatric
what did I
basics.
do?
Yeah, I love that.
Okay, maybe 2 shakes a day and have a protein at night.
Right.
Start there.
Right.
If I feel like I'm getting, that's making me too hungry, then I'll do a shake in the morning for breakfast with 2 meals.
Right. Right.
And then I'll just ease into it. I'm not going to go full force and jump into it because I know for me that never really works for me. I need to like ease into things and then slowly transition to get where
Right.
I have to go.
Love that.
So I think for me, I would just take baby steps and then eventually get back to my normal, okay, working out and eating.
Love that.
Because, you know, there's some people that can't do both. There's some people that are like, I can only work and focus on my diet first, and then I'll incorporate the gym and stuff after. So I think do what works for you, I can say. And I think that I would just, again, like how you said, track the trends, right? Start
Yeah.
back weighing myself every single
Yes.
day or
Yeah.
maybe just once a week just to see how you're doing.
Right.
And then once you start seeing like, okay, everything's going down, the fat's going down, okay, this is starting to work, okay, let me incorporate some gym in there, okay. And now you really start seeing the results faster, which is like an addicting feeling, right? And then that's how I know I think I'll be on track.
Yeah. I mean, one thing that I do see, and you hit it on the head, bariatric basics, because the thing that you can control is your diet and exercise. Now, we
Right.
know that exercise is really for weight maintenance, not so much weight loss.
Mm-hmm.
It's, 90% diet.
Yeah.
So when I see some of these patients come back that have regained a lot of weight for whatever reason in their life, we always go back to the basics. And one place that we start is I'm a very different dietitian. I'm not just going to give you a meal plan and say, here, start this.
Mm-hmm.
I want you to see what you're doing. So what I'll ask my patients to do for maybe 1 or 2 weeks is don't change anything. Take a look at what you're doing. Self-monitor again.
Okay.
Because you might be looking at your diet, at what you're doing, and all you need to do is make one minor adjustment.
Right.
And it might not be so overwhelming at that point.
Mm-hmm.
Maybe you just realize, I'm really not getting my protein. Dr. Lil says I need 80 grams. Oh, I'm only getting 50. Oh, maybe we should start there.
Right.
Right? Or maybe you realize, I'm just doing too much snacking. I can tell you what really leads to that weight recurrence in metabolic and bariatric surgery: snacking, grazing.
Why do you think that is?
Well, I think what we're snacking on are the things that we really like and that are easy to digest, like
Right.
carbs, chips, sweets, things like that.
Mm-hmm.
And we're getting rid of the proteins. We're just not eating as much protein because we're eating the snacks.
Right.
So when you look at the macro breakdown of your diet, it's just flip-flopped,
Right. Right.
So if you take a look at it, at your food diary, and you're like, oh yeah, you're right, I'm just having too many carbs.
Mm-hmm.
But you're actually looking at that number. That's what's in your face, saying, she told me I need to get 80, I'm only at 50. All right, maybe the carbs, I should be at 60, and I'm at 200. It really gives you more of that self-awareness to say, maybe that's what I need to change, rather than just randomly saying, oh, why don't you change this, change that, change this. And then it becomes overwhelming.
Right, because then it's like you're thinking of so many things at once versus focusing on one thing.
Yep.
Yeah.
The
that's a
one
good point.
message I want to send out there, though, is don't be so hard on yourself, okay? Don't turn around and say, you know what, I couldn't even be successful with bariatric surgery. No, don't think that way. Because remember that a lot of this isn't your fault, right? You can't control a lot of this stuff. Control what you can control, though, right? It's not about burying your head in the sand. And go back to your practitioners, right? And if you don't like the one that you had because they were stigmatizing you, go to somebody else, right? Because we understand that weight is going to rebound. We understand it. But we want to catch it before it gets to that 10%, you know?
Yeah.
We want to catch it because it'll be a lot easier. Now, if people do regain more than that 10% back, thank goodness there are other options, right? We do have something called the weight loss medications, right? The obesity medicine management.
Yep.
So there are lots of different ones out there. The semaglutides, which is GLPs. We have, the different phentermine. We've got different types.
Right.
So again, that's an additional physiological tool to help you. Do you still need the diet and exercise? Yeah, you still need that.
Right.
But remember, some of your weight recurrence might not even be your diet and exercise. I've had patients that have had something called a fistula.
What's that?
Fistula is kind of like, it doesn't happen really with the sleeve. It would happen with a bypass or one of those hypoabsorptive, where it's almost like the small pouch is talking to the big stomach. And it's kind of reconnecting itself. It's trying to reconnect itself, in essence.
Wow.
Yeah, that's just an elementary way to say it. But I have a patient, her diet was perfect, her exercise was perfect. She's like, I don't know what's going on. I just keep gaining weight. We got her hormones tested. We did all of that. And then finally, I sent her back to the surgeon. I'm like, can you check out this patient, see what's going on? Maybe she's got a fistula, plus she's having some pain. And that's what it was. And basically what was happening is she was eating and all the food was shuttling into the bigger stomach, and she was eating a lot more than what she should be because both stomachs were handling it.
Right.
So it was pretty interesting. So that was definitely a medical reason. So I would want patients to reach out to their centers. Don't be embarrassed. All right, we're there to help. We're not there to judge. And let's get a physical. Go back to your surgeon, get a physical. Let's see how your surgery is. Is it still intact? Go to your nutritionist, self-monitor, and then let's talk the options. Is it just, all right, we got to get you back on track with your diet anyway, or maybe the GLPs might help.
Yeah.
Or maybe you have a fistula and you need a reoperation.
Right.
So
There's many
there are
different
options.
Yeah.
There are options. But, you know, the foundation is still diet and exercise.
You got to go back to the basics.
You do. Got to go back to the basics.
You know? Yeah.
Definitely. Protein, fluids, vitamins, and minerals, exercise. I don't know. Exercise, the term exercise scares me a little bit. I like to just call it movement.
Movement.
Let's just move
Let's
a little
just move
more.
our body. Come on.
Let's just move a little more. You know?
And try to make it part of your lifestyle.
Yeah.
You know? I think that helps to not see it as
What does that
work.
mean, though? Make it part of your lifestyle. What does that mean?
I think not seeing it as a task. Because I feel like even my entire life, whenever people told me that I had to go to the gym, I'd be like, oh my God. Like you start dreading it before you even put your clothes on. You know? And then it's like, you know, basically now I'm at a point where I bought gym outfits to wear to the gym. I'm like, okay, Corey, you were gone too far now, okay?
I love that.
Yeah, it's just like, I think when you make it part of your lifestyle, it's such, like, now it's so ingrained in you that you're like, I'm going no matter what. I don't care how busy I am. I don't care if I have to work until midnight tonight. I'm going to the gym for a quick 30 minutes and that's it.
Dedication.
You know? Yeah.
Yeah, but what would you say to somebody that says, look, I'm just too busy. I work 80 hours a week. I've got little kids. I got a husband I got to feed. You know, like I'm going to school.
I would tell them, okay, if you want to get your steps in, walk all around your house. Right after surgery, I did laps around my couch for like 30 minutes. Like, I swear, it was like just nonstop.
Right.
And then like I would go to the kitchen and come back to the couch and then go to my bathroom and come back. Like I just was like, listen, this is the only way I'm getting in my steps. I don't want to go outside.
Right.
Because before, as I told you, I was barely drinking and eating. So I felt like I was going to pass out or something. So I'm like, let me stay home.
Right.
And I got in my steps. I made sure to get the gas out. And yeah, I just tell people like, there's no excuse.
I love that.
You know?
You know, I do a lot of desk work, obviously. So I got one of those under the desk peddlers.
Oh, those are good too.
Yeah. I mean, you know, so if I'm doing a virtual call.
Yeah, you can still.
I try not to go like this too much, but, you know, I might be doing my steps or, you know, resistant bands.
Resistant bands
you
are
know,
really good.
so if I'm on a meeting, I'll just keep my camera off and I'm doing some resistant bands. Yeah, it's capturing that movement whenever you can.
Yep.
You know, I think we're very sedentary because a lot of our jobs are like that too. So, yeah, you just got to get up more. Got to get up more.
Yeah.
Yep.
And then too, on the days when you do have the time, try to do more on those days.
Yep.
Right? Like if you go for a bike ride and it's only like maybe during the week you can only take a 15-minute bike ride and now it's Saturday, Sunday, you have 3 hours to spare. You'd be like, let me just do like a nice 30-minute ride somewhere down the street by the beach or something. You know? So.
You know, and I think what's important too is do stuff that you like to do.
Yes.
Like, I'm not really big into the gym anymore. I used to be when I was younger. It's not my thing anymore just because I really hate waiting for the machines. It just annoys me. So now I love bike riding. You know, I love swimming. Awesome. I love dancing. You know, I like to do resistant bands, things like that. Do stuff that you like to do.
Right.
Like, it shouldn't be a punishment.
I'm telling you, it shouldn't. It's supposed to be fun.
Exactly.
It is.
Exactly. You know, I like nature. I play with my dogs, you know. Yeah, so I think all of that counts.
Yes.
You know, even meditation.
Oh, that's
yoga.
That's big.
Yeah.
Yeah.
I think just find some activity that you like to do. You know, and I have to admit, we live in a very hot climate. So sometimes I'm a little nervous telling my patient, oh, go outside and jog. You know, I don't want them to pass out because they got dehydrated. So
that too.
I'm always like, you tell me what you would like to do. You know?
Even I had someone that had said, Corey, like, I see you're into like the running and stuff, but I can't run, you know, when it's like sunny outside because it's too hot. And I was like, well, you know, people run at night too, but it's also, obviously it's not as safe. But I would tell you wear stuff that has lights on it or something where people can see you, bright colors.
Right.
Now he's like, now he said he runs every night.
Oh, wow.
And he ordered like shoes that like,
light up
and like different stuff, and he's got his outfits ready. So
great.
it's like that to me is awesome when you can see like someone who was before making excuses as to why I can't do it, happen to see me running, and then they're like, you know what, let me see if I can fit it in my schedule. And now he does it every day. So awesome. It's like the best feeling.
I think maybe sometimes what holds us back is we're our own worst enemy.
Yeah.
And it's like, I'm afraid to try that. Oh, no, I'm not going to be good at that. Oh, somebody's going to laugh at me.
Yeah.
You know, I think we talked about that too. Just try something different.
Yes.
Just try it. You surprise yourself. You might really enjoy it.
One thing I really want to try is Pilates.
It's really good for you.
I want to try that.
Yeah.
Yeah. I
know
everyone's saying it's for the females now, but I'm like, I see there's tons of men doing it at these
Absolutely.
classes. So I said,
Absolutely.
I'm just gonna take a
I
class.
don't see activity
see.
as gender specific.
Yeah.
Oh.
I don't know,
Oh,
but
definitely.
I think I'm gonna definitely take a class or two
Right.
to see if I like it.
Hey, look, we all have our limitations. Like, I can't jog because I have, spinal stenosis and all that. So I
Right.
can't do things like that. So I have to do what I'm physically able to do without
Right.
becoming, hurt.
Right.
So we all have some of our own issues.
Yeah.
But, maybe reach out to an exercise physiologist or a certified trainer or, a physical therapist.
Right.
Just to really know what should I do to get back into exercise. Because I do have some patients that haven't exercised in many, many years, and to just say to them, oh, well, just, put on your sneakers and start walking, you have
Right.
to be very sensitive to that.
Exactly.
I'll have some patients say to me, yeah, they just want me to go in the pool. Seriously, I don't want to get into a pool. I don't have a bathing suit, things like
Right.
that. We have to
Right.
be very sensitive to things like that. So I usually say to patients, what do you like to do? What do you desire to do? I have a patient, you know what she likes to do? She likes to clean her house.
Cleaning, that burns a lot of calories.
Man, oh man, with that
That's a
vacuum
full body
cleaner
workout.
and scrubbing the floors.
Yeah.
Oh yeah, that's a lot of work. But she loves to clean the house. That's just her thing.
Right.
Come over to my
Hey,
house.
right, come on. Listen,
over my
please
house.
help.
I got another house you can clean. But yeah, so that's what she loves to do, and she stays pretty fit doing that.
That's great.
Honestly.
That's great.
Honestly.
Yeah.
So I think really the message for the weight recurrence, expect some weight recurrence to happen. Okay, let's be realistic about that because your body is kind of saying, oh, you're losing weight. Let's kind of help you gain weight. So also keep realistic what the numbers are. Because I'll have patients say to me, all right, you're 65 years old. You're at a different stage in your life. You're 5'6" and you want to be 110 pounds. What?
Yeah,
That's not realistic.
Yeah.
So I think having that heart-to-heart conversation with the practitioner to say, look, you're not just a number on a scale. If you really want to look at numbers, let's look at your body composition. For some people, they don't even want to see the numbers. I want to be healthy. I don't want to have diabetes. I don't want my doctor to say, you got to take this medication. So I try to meet patients where they're at.
That's great.
But with that weight recurrence, if you see it happening, don't bury your head in the sand. Don't bury it. Let's address it. All right, what's happening? Is it because you had a surgery and you couldn't work out? Or is it because, you're finding yourself snacking a little bit? Are you at a different stage in life? Is there a new medication? I can tell. I'm very honest with the audience, right? I gained 10 pounds in 1 month.
Right.
You know why? I'm on 3 asthma medications.
Wow.
I even had a patient, no joke, a patient looked at me and said, oh, what happened to you?
Oh my God.
Talk about being insensitive.
You're right.
It goes both ways,
Yeah.
And I'm like, thank you.
Yeah.
Do I really have to explain the fact that I was on 3 medications?
Right.
Or if somebody makes a comment like, oh, the unfit dietitian. Oh, okay, thank you.
Wow.
You don't know my
that's
history,
crazy.
right?
Right.
And you also don't know my body fat.
Right.
Okay? I might be a little bulkier, but okay.
Right.
Maybe some people don't like that, but I don't care because it's my body and I'm feeling strong when I walk. I'd rather do that. But yeah, unfortunately, those medications, cause a lot of weight gain. I'm still trying to work on it, but
Right.
breathe or don't breathe. Which
Exactly.
one? Right?
Yeah.
So that's the other thing that I'll do with our patients that regain a lot of weight back. Was there anything that changed in your life? Was there a new medical condition, a new medication? I want to look at that. And look, I'm not a doctor. I'm not a pharmacist. I'm not a nurse practitioner. So I know what my scope of practice is. But I can also look things up and say, well, maybe we can talk to your doctor about this medication. Right?
That's a good point.
And then we'll start talking about, okay, what else in life changed? I have patients where, hey, life is hard. Loss of a loved one, having a baby,
That's
those
also a
hormones.
big one, too.
That's a big one for women, especially women that have had bariatric surgery.
Mm-hmm.
You're expected to gain weight while you're pregnant.
Yes.
You're expected to. You have to for your baby.
Mm-hmm.
But it also doesn't mean flip to the other side and say, oh, okay, well, I got my baby now.
So now I can gain weight. You're right.
Exactly. So that's why I think following up with your healthcare practitioners is really important.
Do you also find that patients in colder states have a harder time losing weight than patients that are in hotter states?
Well, really,
Or
there's a theory that
okay.
when you live in colder environments, that you have more brown fat, which is actually the good fat.
Oh wow.
But I'm
That's
just
amazing.
wondering if the colder environments, just because maybe the activity level is different because you're
Yeah.
not going out as much,
Mm-hmm.
or you're bundled up so you don't even realize that maybe you are gaining some weight, but you don't really notice it too much
Yeah,
because of
that's a
your
good point.
clothing
Yeah,
too.
that's a
I
good
mean,
point.
here we're living in South Florida and everybody's like, oh, let's wear a dress.
Yeah,
Well,
it's beautiful.
some of the guys wear dresses too, but
Yeah, that's it.
as a woman, oh, let's wear a dress, let's wear a sundress, let's wear shorts. So we're more conscious of our body. I
Right.
don't know. Maybe. It's
Hmm.
interesting
Yeah,
though.
it's a good point though.
Yeah, it's very
And
interesting.
so, like, what do you think is like one of the biggest, I guess, challenges of, okay, the person's gained maybe 60 pounds or something, right?
Hmm.
Do you know what's the biggest factor as to why they gained it most of the time? Like, is
You
it
know,
just poor diet, or is it just they just choose not to be active, or
I
is it
don't
because
make
some
the
people?
assumption.
Oh,
I
okay.
don't make the assumption either way. If
Mm.
a patient comes back in, whether they've gained 10 pounds or 100 pounds, I want to find out what happened.
Yeah. Yeah.
Can I say that diet and exercise played a big part in it? Yes, and in a lot of my patients that is true.
Mm-hmm.
Okay, but I wouldn't make the assumption that it was every patient.
Yeah.
Okay,
Yeah.
but I want to work on what we can control, which is diet and exercise. So I
Right.
think a good place would be, yes, the bariatric basics.
I like that.
And in the process, while we're going through this bariatric basics with the diet, they're also going back to their bariatric surgeon. Let's take, a picture of your stomach. Let's see if there are any anatomical changes that might have happened. Let's go to your primary care physician, see if there are any medications that contributed to it. Let's go to your health behavior specialist. Maybe you did go back to some disordered eating or some habits that contributed to it.
Mm-hmm.
You know, just because you have bariatric surgery doesn't mean some of these old habits go away completely. They're just kind of asleep and in remission,
Right.
and then something might trigger it.
That's a good point.
I have a patient, she had a death in the family, somebody close to her that triggered her. A lot
Wow.
of the stress. First of all, the stress of having to make all the arrangements. She couldn't exercise and eat right, and she was lucky if she got, one shake a day. But just the stress hormones and the sadness and the grief. I mean, this is what life is.
Right.
It's not just all go in a straight line and
Mm.
every day's going to be peachy keen.
Exactly.
Yeah, no,
Yeah.
no. So it does take a team. It takes a team.
Mm-hmm.
But don't be afraid to reach out. I think that's the other thing. People are afraid. They feel embarrassed, or they feel like, oh, I failed, or there's something wrong with me. No.
True.
We do know that holding on to weight, if you want to call it obesity, okay, we know that obesity is a pathophysiological metabolic dysfunction. Okay, that means physiology,
Mm-hmm.
right? So it just means you have a condition that needs to be managed. Let's manage it. Let's figure out what derailed you a little bit, and let's try to figure a way to get you back on track with that.
I like that.
And it might be a combination of many things. It might be diet, exercise, health behavior specialist, surgery, medications. There are options out there. To just say, nah, I'm not going to go. No, I'm not going to go. And then the weight just keeps going up and up and up. And then before you know it, you got your diabetes back, your sleep apnea back. And now you're really feeling even worse.
Right. Right.
Yeah, no. Reach out for help. Definitely.
And I think too, one thing that plays a part is a lot of the patients are very hard on themselves.
Yeah, I agree.
I don't know. I mean, I get it too, because from being overweight most of your
Yeah.
life, you do tend to like blame yourself for things, and
Right.
especially now when you go through this surgery and like throughout the months, you're very excited of coming to the support groups and saying, "Oh yeah, I'm down 20 pounds. Oh,
Right.
I just did this non-scale victory. Oh, I traveled here." Like
Right.
you have all these wins, and then you finally just flip it, and now it's like, "Oh my God, like I'm
Right.
back to square one." So
Right. Right.
I can see why they feel embarrassed and stuff like that, but
Mm-hmm.
I don't know. The bariatric community is so supportive. I think even if I was in that position, I think I would definitely ask for help, because
Yeah.
everyone is willing to help.
Yep.
Everyone knows that we all go through things,
Yeah.
especially, life is always ups and downs, like how you said.
Mm-hmm.
So I think,
Mhm.
just knowing that you can always reach out to anyone and
Oh,
people will
yes.
stop everything to try to help you, that's like the
Right.
best feeling. So,
You said so many important things there, Corey. First of all, you said support.
Mhm.
Okay. Support groups are really important. All right.
Yeah. It's huge.
whether or not you have your own Facebook group or your TikTok group, your Instagram group, or it's a support group that's more formal through your program, I think support is super important, right? Also, whoever is in your inner circle that supports you, and I
Yeah.
know some people might not have that, so
Yeah.
reaching out to the bariatric community is important.
Yeah.
You know, I'm embarrassed to say that unfortunately the way patients feel sometimes about their weight wasn't helped by the medical community, because you went to your doctors or your nutritionists or your nurses and they said, just, eat less and exercise more. Okay, that wasn't the right message. That was
Right.
inappropriate, first of all. It wasn't being very sensitive. It made the assumption that you were eating poorly and didn't exercise. That's an
Right.
assumption. So there is a lot of, weight bias and stigma that's unfortunately still out there. And I was shocked to see a report that showed that even dietitians are like that. I'm embarrassed. I'm embarrassed to say that.
Right.
There are dietitians that have this stigma against patients that hold on to weight. That's just heartbreaking.
Yeah.
So the way you're feeling is understandable, but it's also, okay, let's do something about it. Don't go back to that practitioner, find somebody else.
Right.
Because there are people, a lot of people, that really understand what this condition is and want to help. And I think that's why I love this field so much, because I have met the most amazing surgeons, physicians, nurse practitioners, nurses, health behavior specialists, exercise physiologists. This is what we've devoted our life to.
Right.
So definitely find somebody that can help you, And even being hard on yourself, look, that's you. I'm not going to judge you. But let's find strategies to get past that so you can reach your goals.
Yes.
Okay.
Yes.
Because, a lot of us have had a tough life in very
Yes.
different reasons.
Exactly.
But, we're only on this planet for such a short amount of time. And if you have a goal, you got to work at that goal. It just goes to show, hey, look, bariatric surgery is not the easy way out.
Not at all.
And sometimes patients might be going into it thinking it is.
Yeah,
They
they're thinking like,
themselves.
oh, I'm just gonna get the surgery
Yeah.
and then that's it.
Yeah.
Now I
Or
can
even
enjoy
with
life.
the weight loss medications. Some people are even
Oh,
doing
that
that,
too.
thinking, I'll just take a pill. I'll just take a pill.
Mm-hmm. Until
you-
they realize they have to keep taking it.
and it's always a responsibility. There's always a side effect. There's always a responsibility.
Yeah.
There's always a consequence. I'm just glad that there are different modes of treatment. I always call it multimodal because it's not just one method to help the condition. I think it needs to be many.
Right,
really
especially for
do.
different body types.
Yep.
And
Yeah. But I just want you guys to really evaluate the numbers the right way. If you really are numbers driven, you got to make sure you're looking at the right number. If you're just on the scale thinking, I want to be 120, 140, what does that even mean?
Right.
Look more at what is your body composition? What is your health factor? To me, it's a success when patients say to me, I crossed my legs for the first time. They
Yeah.
lost 10 pounds, but they can cross their legs. It doesn't matter to me, the weight per se. Or patients say, I'm not on any diabetic medications. Oh my
Isn't
God.
that the best thing?
Oh my gosh. It's amazing.
Right.
It's amazing.
That's what I tell people. It's just
Yep.
and I think too what you said about tracking. A lot of people hate tracking, but it's the easiest way to find out what's going wrong.
Now it is. Again, I have to say,
Yeah.
when I started out in bariatrics, okay, we didn't have apps.
Oh yeah, to track it.
There's nothing called an app.
Dr.
You had
Lil,
a
it's even
food
gotten,
diary.
It's gotten so crazy that they've gotten these other food tracker apps
Right.
installed with AI, so you just have to scan it, and
there you go.
it brings up everything
Okay.
for you. You don't even have to type it. Just put the camera out
Look
there
at
and
that.
it'll
So
scan it.
now you don't even have to type it.
You don't have to type.
You know what I had to do? Look, we didn't even have the internet to look up stuff. You had to,
You had to write
look
on
up
paper?
write on paper and look in a textbook.
Oh, see, yeah.
I still have that textbook, by the way.
Oh my
I
goodness.
still have it. It has a list of all these different foods, and you had to look. Oh,
Oh,
my
wow.
gosh. Can you imagine? So things have gotten easier.
Yeah.
Maybe you just need to know what these tools are to help you, And I would say be realistic. Set up goals. Try not to think too far ahead. Set up a goal that's reachable.
I think people should do a month-to-month goal versus because there's so many people that are like, oh, by the 12th month, I gotta be this size and this, but it's like you skipped everything in the middle. Like you're just focused on the end goal,
Right.
thinking like in 1 year I'm gonna get where I want to go.
Right.
Some people
right.
it takes longer. Some people can do
Yeah.
it in 6 months. It just
Yeah.
depends on you.
I'll have patients say that to me. Oh my gosh, this is my 1 year anniversary. I'm not at my goal weight. Oh, okay.
So many people say that.
And who said that 1 year is the date?
Right.
Whoever said that?
I don't know. I don't know.
You know?
Yeah.
And the other thing, try not to compare yourself to others.
Oh,
That's the other thing I see
that's a
too.
big one. I feel,
Try not
especially
to
on
do
social
that.
media.
I know. Okay, but apples and oranges.
Yeah.
Okay, they're two different fruit.
Yeah.
You just, you know,
It's
you
so
just
many
can't do it.
factors.
Yeah,
It's so many factors
yeah,
involved.
yeah,
You know, especially people live in different places. The age might be different.
yeah.
Your daily life might be different. Your jobs. It's so
Okay,
many
I'm not
factors.
comparing myself to you.
Right,
All
we're different
right, I'm
lives.
much older and I'm a woman and you're
Right,
much younger and you're a guy.
right.
Okay, really?
It's
Am I going to
different.
compare my health and my weight to you?
Right.
That doesn't even make sense.
Yeah.
All right,
Yeah.
so again, have some, common sense in there too,
Exactly.
you know?
Exactly.
So these are the steps. First of all, when you enter your journey of weight loss, be realistic. Think about what your goals are, and they shouldn't just be numbers driven from a scale. It should also be quality of life. It should be health, medications. That should be part of your goal. If you're numbers driven and you're looking at the scale, well, extend that. Look at your body fat, look at your muscle mass, come up with your goals. Maybe I don't want to be a pit bull. I want to be a greyhound. Okay, but my body fat is normal. Okay, great. If you've regained weight, what you need to do is I would go back to get a physical. Let's find out why. Talk to people. Talk to your nutritionist. Talk to your health behavior specialist. Talk to your doctor. Talk to your surgeon. Talk to the community. Find your support group. Okay. If somebody is judging you, you're going to find somebody else.
Exactly.
Right? Find somebody else because you don't need that person.
Yeah.
And then make small, reasonable, attainable goals. And if you're saying do it monthly, then do it monthly.
That's it.
know?
Or if you want to get even smaller, set a goal for the end of the week.
Yeah, that's what I do. I just
Yeah,
want to make it.
that's Just make it a Sunday. That's it.
Make it to Sunday.
That's it.
And see what the options are. Don't feel like, oh, now I have to take a pill. Oh, I have to go in for a reoperation. Oh, I have to. No.
You
know
don't have
what?
to.
If you needed a heart valve, wouldn't you go get your heart valve? I
Right.
mean, you need the tools. If you need the tools, you need the tools.
Right.
When I'm planting my garden and all I have is a shovel, but I need a clipper, I can't
Right.
get the job done if I don't have the clipper.
Need the right tool.
You need the right tool.
That's it.
Exactly right.
It's a nail on the head with that.
I
Yeah.
mean, that's what it is. It's just multimodal. But also on the flip side of that, also take personal responsibility too, because you know
Yes.
yourself the best.
Exactly.
So if you know, I've kind of engaged in some eating behaviors that I probably need to stop.
Mm-hmm.
Okay, so what are you going to do? What's your goal? If you know that you started on the bag of potato chips because they were easy to eat and they tasted good and they helped your emotions, okay, so what's the goal? What are you going to do?
And notice how all this comes back to like the mental aspect of it.
Always.
It's always
Yeah.
this happened because I was mentally going through this, or I was.
Yeah.
That's why I said this journey is so mental.
Yeah.
Even though we talk about the weight recurrence and stuff like that, but
Yeah.
it's like that's one of the biggest factors I think that causes it.
Yep.
I mean, besides the other factors and everything else, but the mental
Emotional.
aspect,
Yeah.
It's
Yeah.
like if the emotions are up and down, then people start snacking more,
Right.
or just not going to the gym or not being as active.
Yep.
So
Yep.
everything plays a part.
Yeah, it's
I
very
think,
true.
Yeah.
But again, we have to be realistic with life. Look, we're not AI robots.
Exactly.
Life isn't going to go into a straight line. We're going to have deaths. We're going to have births. We're going to have weddings. We're going to have funerals. We're going to have hurricanes. We're going to have sunny days. Just got to prepare yourself. Be prepared. Be realistic. Come up with strategies. I'm not an emotional eater in the sense when I'm upset. When I'm upset, I don't eat. But I don't want to
Really?
be upset all the time. That's not how I want to lose weight, right? But I am an emotional eater in the sense that when I'm really happy, come on over, let's have a pool party, let's, make some nice protein shakes, but
Right.
that's also part of an emotional eating because I'm using food as love, I'm using food as a reward,
Right.
and that's just what we do. It's part of our culture. You can't separate that sometimes.
Right.
So, and I'm not saying to separate it. I'm saying just manage it.
I like that.
Yeah, you got to manage it. Like I said, you guys know yourself the best, right? You know yourself the best inside and out.
Yeah.
Literally, figuratively, and everything in between. But not doing anything is not going to get you where you want to get to.
100%.
So I think it's just maybe talking it out and being realistic. I think now we want to get from A to Z.
Right.
you
Without
know?
doing the steps that are in the middle.
Yep.
Yeah. Yeah.
Yep.
Even though we talk about weight for currents, right?
Mm-hmm.
And I know you speak to so many patients. Have you had any patients where they're like, I don't know, let's just say 10 years post-op that
Mm-hmm.
have kept the weight off?
Oh, yeah.
Yeah.
I would say the majority.
Oh, wow.
The majority of my patients are, yeah, did they bounce up and down a little bit? Yeah,
Mm-hmm.
they're in a weight range. Yeah, but I have, and I'm not going to call it successful or unsuccessful. Those aren't the terms that I use. I would say that patients have maintained a healthy body and lifestyle. Yep. And they've realized, yeah, I'm getting older now. I gained the 20 pounds, but you know what? That's to be expected. And I'm
Right.
still healthy. I'm still active. I'm still eating healthy foods. So it wasn't like, oh, I gained the 20 pounds. Okay, they were realistic about the 20 pounds,
Right.
you know?
Right.
So, but yeah, our patients, what I see is longevity. Again, I've been in the field a long time. So I have patients that have had surgery 25 years. Yeah, and even longer than that. I've had
That's
some
amazing.
patients, yeah. They were like the originals.
Right?
Yeah, yeah. Yep.
Wow.
And I do have a patient that I'm thinking about. She had what's called a reoperation. So she had a gastric bypass and she did very well, but there was an internal complication over the years. She had a hernia and things like that. So she went in for a reoperation. She's doing amazing, but is she
Oh,
still trying to manage her weight? Yes. That's what humans should do. We should
right.
be managing our weight,
Right.
you know? And now she's 80
Oh my
years old.
gosh. 80?
Yeah,
Wow.
yeah,
I feel like weight management seems to be like the most important
yep.
because I
Yep.
mean if you can't manage it then you'll just lose it, right?
Right.
Yeah.
I would say a holistic approach, right? Isn't that what life is? Manage
Yeah.
your emotions, manage your finances,
Right.
manage your relationships,
Yeah.
manage your weight. It's all about managing
Managing.
it. I don't know if there's, not going to be 100%. What's 100%? What's perfection?
Nothing
There is
is.
no perfection,
Yeah. That's a good
you
point.
know?
That's a good point.
But I think what's really nice is that, build these relationships that you trust. Like, you can always talk to me and
Of
say,
course.
hey, Dr. Lil, I just gained weight. Or, hey, I'm losing too much weight. Help me out here.
Yes.
Or I can say to you, hey, Corey, I was on some medication and I gained some weight.
Yeah.
I can even say that to
Yeah.
you.
Yeah,
And,
of course.
because there's still a lot of judgment out there.
Yeah. And I think
But
too, I've noticed this. A lot of people will lie to their nutritionist or lie to their doctor.
they
thinking
tell
they're not gonna
different
find
stories.
out. Yeah.
They'll just tell different
Basically.
stories.
Yeah.
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 Yep.
And it's like, and then it's like, as soon as they either are like either doing a post or something and like they'll
Right.
say what they actually did.
Right.
And then I'm like, but you're only cheating yourself.
Right.
Because in the end, you have to face yourself. It's
I
not
know.
like yes,
know.
the person's here to help and guide you, but
Right.
okay, you are lying to the person that's gonna help you when you need them most. Like I know
Yeah.
if I gain 80 pounds, Dr. Lil, we need another 12 sessions. I need help.
I
Like,
know.
I'm calling you right away.
The thing that's interesting,
Yeah.
though, is usually the practitioner already knows.
Yeah, like before they start.
Yeah,
Oh,
as
okay.
as you're telling us the stories. I mean, this
Mhm.
is what we're trained to do. We're trained to
True.
listen to what you're saying. And you might just say different versions to different people.
Mhm.
Maybe the version is a little bit different in front of the surgeon than it might be in front of the nutritionist and vice
That's
versa.
good. Yeah.
And that's why it's really good to work as a team. But I think first and foremost, it's all about building the relationship. I understand where that fear might come from. You're embarrassed about it. You've had bad experiences in the past, so I understand it. Because I would do the same thing.
Mhm.
Yeah, I'm not going to tell you the whole story,
Right.
But once you start building that relationship, let's talk about it. I mean, you and I talk about everything and anything because we
Yep.
trust each other, because we
Yep.
know we're there to help each other genuinely.
Right.
It's not a judgment at
Exactly.
all, ever. And that's how we treat every single person, every
Mm-hmm.
single patient. We had this discussion on the way here about empathy, right?
Yeah, I remember that.
So we're taught as healthcare providers and practitioners, be empathetic to your patient. I was like, well, what does that even mean?
Mhm.
And my professors would define it as, walk in the shoes of your patient. That's empathy. Have empathy. And to me, that didn't even make sense either. Because if I never suffered from abuse, or I never suffered from obesity, or I never suffered from a transplant, and how would I really know that?
True.
So to me, I changed that definition to really having empathy for your patient is having the deep desire to learn from the perspective of your patient, what they're going through. So that means I'm truly interested. I truly want to help. It's not about having judgments. I'm not in your life. I don't
Right.
I don't know what it means to be you. But I want to learn it. So I want you to trust me enough. So I think it is about building relationships.
Yes.
I really do.
Yeah.
So, and I know again the bariatric community is really wonderful, very supportive. And the people that aren't supportive, well, guess what? For every one person that's not, you've got 10 that are. And it's the same thing with practitioners. I can tell you that patients that go to bariatric centers that are, centers of excellence, that have the surgeons and the nurses and the nutritionists, I mean, this is what we do. We understand the concept of weight. We want to help. And if somebody says something off, look, we're only human, but if it's something that you don't feel comfortable to say, well, why did you say that? Explain that a little bit more.
Right.
Go find somebody else. Find
Agreed.
somebody else.
Right.
Don't use it as an excuse to say, well, see, nobody can help me.
But a lot of people like doing that.
Right.
Yeah.
Because
They
it's
use it as a
easier.
crutch. Yeah.
It's just easier.
It is.
You
They're
know,
facing the actual problem.
change is hard. Change isn't. If change was easy, hey, we wouldn't have problems.
Yeah.
It's just hard. And remember that behavior change and health behavior change is not a product of education. We're all smart. We all know what we need to do. We all know the bariatric basics. We all know the difference between a protein and a carb. It's not about education. It's about motivation. That's behavior change. What motivates you? I have patients that'll say, I have to be alive for my kid. And I know that if I don't do something with my health, I'm going to be dead. Right? So their
Right.
motivator is not so much themselves per se, it's their kid.
Right.
So motivation is also very personal. What motivates you? I'll have some patients say, well, I'm going to a Miami party and I got to get into that black dress. Okay, that's that person's motivator.
Yeah.
That's what's motivating them to make, diet and lifestyle change. Again, it's not a judgment. I'm not going to malign somebody because they want to look nice in a dress.
True.
Okay?
Right.
But you got to find what your motivation is and make changes to reach your goal. It's not going to be easy. We're not like Harry Potter, wave a wand, and
And magically it happens, right?
not going to happen. It's a
Yeah.
lot of work.
Yeah.
It's a lot of work. But, anything good that happens, I think it does require work. Anything that you really want to, succeed at requires work.
Yeah. Yeah.
you
And I
know?
think this is the perfect test to it too. I mean, like people love talking about like pre-surgery. I think that's the best test because you really get to see can you really handle it.
Oh, I know.
That's like
That's
a wake up
not-
call for
yeah.
everyone.
Yeah, that's hard.
Yeah.
It's hard physically and emotionally. Like physically to put somebody on a pre-op diet where you're on a liquid diet to shrink that liver for surgery. I mean, just physically, that's hard to do.
Yeah.
Just because you're hungry, you're feeling sick. So physically, and then emotionally going through that detachment of food and those emotions like, oh my gosh, I might not be able to ever eat that again or drink that again. I don't know
That's
how I'm going to
huge.
be after surgery. What am I going to look like as I lose weight? I mean, so much
So
is going through
many-
your mind.
Yes. Yes.
You know?
And then too, people are thinking about like, oh my God, am I making the right choice? Because
Right.
if I lose the weight, now I got to deal with skin. So
Right.
now people are just,
Yeah.
it's just so
Yeah.
many factors.
Sure.
So many factors.
Sure. That's
Yeah.
why I love to hear your story. That's my empathy. I want to hear your story. And every story is so personal.
Yeah.
And if I have the privilege to be part of your life to hear your story, I mean, that's a
That's
privilege.
awesome.
It's a
Yeah.
privilege,
Yeah.
But that's my way of kind of giving back to humanity a little bit. Is there something that I can say or something I can help you with or educate you with or maybe just switch the paradigm of thinking a little bit? Then that's what I want to do.
That is great. That's great.
And you even said it too, just now that you have your lived experience and you to reach out to, or patients reaching out to you, your fellow peers reaching out to you and say, hey, can you help me with this? Give me some advice. Or your advice helped me with this.
Yeah.
You're reaching somebody's
it's the
life.
best feeling.
Yeah.
It's the best feeling. Like how we said, you can't put a price on that.
Nope.
That's just like, even knowing that you made a small impact in their life, like
Yeah.
they're not gonna forget that.
Nope.
They're just not.
Nope.
And I think it's so awesome experiencing just a small glimpse of it, because I know
Mm-hmm.
you experience that on a daily
Mm-hmm.
basis, but I'm just like, this is amazing.
Feels
You
really
know, it
good.
feels really good.
It does
You
feel
know,
really good. That's
yeah.
the humanity part of it,
Mhm.
you know?
That's true.
And look, we're imperfect creatures. We're going to say things wrong sometimes,
Mhm.
but, really, it's a good way to be.
Yeah.
But yeah, so the weight recurrence, kind of anticipate it. Don't
Mhm.
be so afraid of it. If it happens, try to take the emotions out of it if you can. It's called
Mhm.
emotional intelligence. Look
Yeah.
at it more objectively. Okay, I haven't changed my diet, haven't changed my exercise, but that scale's going up. What's going on? Well, I don't know. Let's find out.
Right.
Let's find out what's going on. Or, yeah, that scale went in the wrong way. Okay, what just happened? I had a death in the family. I got off my proteins. I started snacking. Okay, verbalize it. Now let's get back on track. It's not
Right.
about a judgment.
No. No. Not at all.
Mm-mm.
Especially, uh, I think too. Throughout this process, you start to realize like there really is no judgment,
It shouldn't be.
and I
There
think
is.
as people start seeing you change, people
Yeah.
actually want to help.
That's
Yes,
good
there's
that you're
some.
experiencing that. I like that.
Yeah, I've started realizing that like once people see you happier, they also want to like
I love
add
that
to
you're
that.
saying that because I have to say, I've had some patients say to me, oh no, people are trying to sabotage me because they see that I'm getting healthier and
Mm,
happier. And again, I'm not a health behavior specialist, so it's not my wheelhouse.
right,
I want to
right.
listen to what your story is, but then I might also say, yeah, I've got this really great psychologist that I want you to talk to that specializes in this,
That is good.
because I will have patients say that there are saboteurs around them.
Oh yeah,
So I
definitely.
throw out the unconscious saboteur, hoping
Yeah.
that they're really unconsciously doing things like that. Like when
Mm-hmm.
somebody says, oh, you're losing too much weight. That's a comment that can be really taken the wrong way,
No,
right?
seriously, yeah.
Oh, you're so
We had talked
skinny
about that.
now,
Yeah,
right? Or,
yeah.
or they might make a comment that they think is supportive, but it's kind of sabotaging you a little bit. Or you never know how the person might be taking it. I can tell you from a personal perspective because I'm very
Mm-hmm.
conscious about my weight because I've had eating disorders and things like that, a whole different podcast.
Mm-hmm.
When I'm losing weight, if somebody ever mentions it to me, like, oh, it looks like you're losing some weight, I self sabotage myself the other way.
Really?
Hmm.
So do
Yeah.
you feel like you're getting too small then? Do
No,
you start thinking like,
I'm self conscious of it.
oh wow,
I don't want anybody to make any mention about my weight
mm,
at all. Whether I've gained weight, lost weight, stayed the same. Why do you have to mention my weight?
right,
It's none of your business.
right,
So even though somebody might think that's a compliment,
right,
oh, Dr. Lily, you've lost some weight.
mm-hmm.
That's an insult to me.
Right,
And so that's what I'm saying is that people need to be a little bit more sensitive in what they're saying because you never know how it's received by the person you're giving it to.
true.
So I know as a medical professional, as a, nutritional professional, I was taught don't mention weight. So when my patients come in, and I had to learn this.
Mm-hmm.
Patients with bariatric surgery are coming in and they're getting on the scale and they're losing weight. They're expecting me to say, "Oh, good job, you lost some weight."
That's right,
But
yeah.
I don't.
Oh,
So they'll say, well, are you happy that I lost weight? But I would turn that around and say, well, I know you're working hard at your goal. How do you feel about losing weight? It's not about
oh,
me.
right, you're right. That's
It's
true.
not
Yeah,
about me.
yeah.
It's about you. So I'm not a cheerleader. I
Mm-hmm.
don't say, oh, yeah, you met your goal.
Mm-hmm.
No, I'm there as your facilitator and your supporter.
Right.
Because if I were to do that, what would happen if you didn't lose weight?
I was just thinking that.
Right?
Yeah.
What would you
Yeah.
feel then?
Right, because then it's like, do you cheer still, or
Exactly.
are you gonna just be quiet? Yeah.
Exactly.
Yeah.
She's not going to cheer for me today, or she's going to be disappointed in me today.
Mm-hmm.
Oh, it's nothing to do with me. It's you.
Right. Right.
So that's all part of my training.
That's actually really good, Doctor.
It's part of my
I
training.
did not even think about that.
Well, most people wouldn't. It's not part of
Yeah.
your training.
Yeah.
But I will have some patients that get insulted, like, well, what do you think? So then that's when I turn around and say, what do you think?
Mm.
I know
Like you
you're
just
working
shift
really
it.
hard.
Yeah.
Yeah, I know you're working really hard.
Wow.
Yeah.
Wow.
Yep. So that's why I wouldn't expect somebody to say to me, hey, Dr. Lil, you lost some weight today. Really? Thank you.
Mm.
My weight has nothing to do with you.
Exactly.
You
You're
know?
right. You're right.
So I think we just have to be a little more sensitive. And that's what I mean about those unconscious saboteurs that might be around us. you know, friends. I've had patients say to me, well, I lost some friends who I thought were friends. They're not my friends
Yes.
anymore. I've heard a lot of those stories too,
Mm-hmm.
you know, or even family members,
Oh,
even
yeah.
spouses.
Even people forget that you had the surgery and they're like, oh, come on, eat some more. And I'm like, did you forget that I
Right,
had the surgery?
right,
Like,
right,
it's, yeah,
right.
it's
So you
definitely
wonder,
hard.
why are you telling me to eat more?
Yeah.
You know?
And then there's some people that are secretly jealous that are like, come on, like you can eat more. It's fine.
Right,
It's okay.
right,
Cause now they see you looking better, feeling better,
right.
you know?
Yeah.
So,
So that's why it's, you know, bariatrics is so fun and amazing, and it's a wonderment because it's so personal, and it reaches every single aspect of your life.
right.
Every single one.
Yes.
Personal, mental, physical, medical, health. I mean, it's
And it creates a new one, you
does.
know? It tests the old one and creates a new one.
Right.
It's one of the craziest experiences I think out of like any surgery, anything. I think like just all around, just
Mm-hmm.
it'll test you in so many ways that you never thought. And people go, well, you just got your stomach cut. Like that's it,
Exactly.
you
Oh,
know.
you took the easy way out to
That's
lose weight.
it. Like if you only knew.
That's why I really
You know?
hope this information that we put out actually gets to people that didn't have surgery, so they can realize, hey, look, your family member had surgery, or your girlfriend, your boyfriend, your husband, whoever. You know, be a little more sensitive because it's
Right.
not the easy way out.
Right.
First of all, making the decision wasn't easy.
Mm-hmm.
And then once they decided to go for it, what you had to do to get it with all the clearances and
Oh my
everything you had to
gosh.
do, and then the pre-op diet and the judgments and then the post-op.
Mm-hmm.
There's nothing easy about it.
And
And then still struggling with the fact, oh my gosh, after all this, I'm going to have some weight recurrence.
yeah.
That
Yeah.
could happen because I have a metabolic dysfunction that's going to kind of work against this.
Right.
And
Right.
it's something I have to manage.
I think that's also why it's key for people to get a therapist or talk
Yeah.
to someone that can help with a lot of this stuff,
Mhm.
because I think it helped me in the beginning stages, because
Yeah.
I know if I didn't, I just would be inside of my head so much on
Right.
certain things.
Right.
So being able to just have someone that you can talk to that
I agree.
understands it, and you know, and it is hard finding a bariatric therapist.
Hey, look,
or,
I
you know,
obviously I know everybody in the field,
yeah,
right?
exactly.
There are amazing health behavior specialists that specialize in metabolic and bariatric surgery. Oh my
That's
gosh.
so great.
And in every state.
Yeah,
Okay.
yeah.
So I think another really important point is patients need to get on the website,
Mhm.
asmbs.org, American Society for Metabolic and Bariatric Surgery.org.
Mm-hmm.
You know, and it's, yes, that is our professional association that kind of guides the practitioners, but also helps the patients.
Right.
So if you're looking for support groups, if you're looking for names of practitioners that specialize in this, that's your resource.
That's awesome.
That's your resource.
Yeah, because when I was trying to research, I found probably two that
Yeah.
that were close to me,
Right.
and I only found one that like really understood like
Right.
everything about my journey, and
Right.
that's why I chose her.
Right.
But
Right.
besides that, like even you saying that, I really wish more people knew about that resource, because
Mhm.
it would just make it easier for
Right.
people to have access to
Right.
these things. So
It's the same thing with dietitians. I mean,
Mhm.
we dietitians are trained in multiple specialties,
right.
but this is my specialty. So, you know, transplant is not my specialty.
Mhm.
You know, diabetes is not my specialty. I don't even know those medications, right?
Right.
But bariatrics, yeah. So if bariatrics is what you're going through, go to the best person that's going to help you that's trained with the specialty. That's what I would say.
Right. To go
And yeah, so turn to asmbs.org.
for it. Okay.
Get on their website.
I like that.
Yep. OAC.org is another one, you know, Obesity Action Coalition. I mean, again, another wonderful resource. The Academy of Nutrition and Dietetics. You know, so there are lots of great resources out there.
That's great.
Yeah.
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 I think
Our
more people need-
podcasts.
Our podcast, come on. Stop by anytime.
There you go. Yep. Yep. Yep.
No, I think it's good though. I think more people need to hear that, because
Mhm.
I don't think they get put on a pedestal just as much. I think, you know, people probably have heard these names but never
Right.
really like went to the website or never really checked it out.
Right.
You know, so
Yeah, you should.
I think it's good that we're pushing it.
Yep.
So
Definitely.
I like
And
that.
maybe that's the first time you've ever heard of that website.
That too. Yeah.
I mean, yeah, there's a whole big professional group that governs metabolic and bariatric surgery and the obesity medicines as well. Anything that has to do with weight management.
Wow.
Yeah,
That's great.
that's my specialty,
Okay.
and again, I was fortunate enough to serve on a council of this
Isn't that
organization.
great?
Yeah. And do the research and have those opportunities so I can be a better practitioner for you guys,
Right.
you know.
Right.
And I'm still on committees and,
That's why she's the best,
I've
guys.
done a
That's
lot
why
of
she's the
stuff.
best.
It's a lot of fun.
Yeah.
But
Yeah.
believe me, I've been through my own stuff too.
Mhm.
There are lots of unconscious saboteurs around me.
Right.
Believe me, a lot
Right.
of people that weren't so nice to me, but we say, okay, that's okay. I'll
Right.
prove you wrong. Give me the challenge. I'll prove you wrong. And the funny thing is that we all know it's funny because I guess when people say mean things, I don't know, do they think that the person that they're saying it to doesn't realize that you're saying something mean?
Yeah.
Yeah.
It's almost like they don't even realize it.
I know
It's like they're just talking, you know?
Yeah, I guess so.
Like you ever see people that just like say the first thing that comes out their head, like
Yeah.
they don't think about it first.
Yeah, well,
Yeah.
maybe we should think about it. Just be a little kinder to each other.
Exactly.
We all have our thing, all of
Yeah.
us, you know.
Yeah.
So, but that's my take on the weight recurrence. I think, weight recurrence is inevitable,
Mm-hmm.
but is it going to be unhealthy weight recurrence or weight recurrence that is still acceptable and okay and healthy, you know?
Nice. And you feel like currently right now, is there like anything or anyone in your life that's sabotaging your success to achieve like the weight loss or is there like any factor that you think is sabotaging it? It could be like the medicine or it could be
Think about it.
Yeah,
Definitely.
definitely medicine. Yeah,
Yeah, and interpret the number right,
that too.
because we're just so numbers driven,
Mm-hmm.
And remember, I think social media is great,
Yes.
but it can also hurt a little bit too.
A little bit, yeah.
So be realistic, and if you're not sure, reach out to the professionals that can help you and say, no, apples and oranges. Apples and oranges.
Make that distinction.
Yep.
Yeah.
Yep.
Well,
Yeah.
I'm glad that I haven't hit that wall yet or that challenge.
That's why sometimes I'll say some stuff to you.
Mm-hmm.
I don't know if you realize.
What?
You might.
Oh.
You might. Like when you said, well, I work out twice.
Mm-hmm.
I'm not trying to discourage that.
Mm-hmm.
I'm just trying to say, is that sustainable?
Oh, yeah.
Because that's the other thing that sometimes what I see with weight recurrence is people go in hot and heavy. They're doing the gym, they're doing their diet, they're taking creatine, they're going all in.
Yeah.
And then something derails them, and then that's it.
That's true. But but I think again, if your mental's not strong enough, then it'll take you way up, of course.
Right.
Because I think even too when I got the other surgery, I think yes, I was upset I couldn't go to the gym, but I didn't let it take me off my course. Like I still was trying to be strict on my diet and stuff.
Right.
So I think that's kind of how I knew like
Right.
okay, I have changed.
That's good.
Because the old me would have went back to old habits.
That's
and-
good because that is what I
Snacking more.
see. People won't be able to exercise as much because of whatever, but they haven't changed their diet to accommodate
That too.
the new lifestyle. Yeah.
Right. Like you can't keep eating the same amount of carbs you had when you were burning 4,000 calories a day. Right?
Sounds familiar. Yep. Very good. And what I love
Right.
to see with you is that you're elevating your activities too. You're doing different things.
Mhm.
Like you were always very athletic with pickleball and
Yep.
things like that and weight training. Now you're running and you're doing
Yeah.
lots of different. Now you're thinking about Pilates.
Yep.
So you're always thinking, all right, what's the next thing I can do?
Yeah. Always.
That's an important message too, because I'll see some people, they're doing their exercise, they're dieting, they're doing great, but they're like, hey, doc, I'm on a plateau. I'm not doing anything. I'm like, okay, well, you see athletes, how they have to constantly train to get to that next level.
Right.
It's kind of like us. I bicycle ride. All right, it really isn't. I can't use it for weight loss. It's not doing anything. I'm already fit at what I cycle, but I would have to do something else, like go back swimming or dancing or Pilates.
Right.
Get to that next level. Exercises different muscles, makes different mitochondria.
Yeah.
Yeah.
That's true.
So
That's true. Yeah.
Yeah. So
And I
that's
think
good.
we did good too about talking about like creating goals and stuff too.
Yeah.
Because I
All
think
right, what's your goal? Are you going to give me a
My-
monthly goal? A 1-year goal? A 6-month goal? What's your goal?
My goal is I want to be able to run a marathon by the end of this year.
Wow, actually
If I
run
can.
it, huh?
Actually, well, yeah, because I've been getting into running. So my short-term goal to that is to do a half marathon by end of summer. If I do that, I know I can handle doing a marathon.
Wow.
So that's just like my two big goals right now.
So you're training towards that?
Yeah, that's why I've been I've been doing the gym, but I've been heavy on the cardio part now. Like I'm probably running like 6-7 miles a day.
Wow.
So.
All right, so you said another really important thing. So not only did you create a goal, but a strategy to reach that goal.
Yeah.
Because that's the other piece that sometimes is missing with my patients. They'll write out beautiful goals. Oh, I want this, I want that, by this, I'm going to. But, okay, so what's the action plan to get there?
Right.
Oh, I'm not going to do anything. You mean,
Yeah,
what, I have to do something?
What do you mean?
Right.
Yeah.
Right.
No, it's like
Right.
it has to be a plan with some action behind it.
Yeah.
And I realized that like everything works as long as you follow it. If you don't follow it, it's so easy. Like I think you had mentioned something about just give your body a different signal.
Yeah.
Like just give it a different message.
Exactly.
And it's so true. Once you change something that's not good for your body will let you know.
Right.
So,
Right.
but yeah, like it's just been now just being hyper focused on like everything I'm trying to accomplish. And, you know, I definitely know I'm going to do it. I know it's going to take work, but I think I'm going to feel good just knowing all the months of hard work paid off
That's
after
great.
I do it. So,
That's really great.
yeah.
All right, so setting up goals and then action plans. And
Yes.
sometimes you might have to pivot a little bit.
Yeah. Or
You know?
there's sometimes or certain times you might need to take more rest days just to offset all the hard work you've been doing too.
Right.
That I've been seeing. So,
Right.
so maybe instead of taking one rest day, you may need 2 rest days that week because your body's just feeling extra tired for some reason. Or maybe you didn't get enough sleep. Sleep is a big factor.
Sleep is a very big factor.
Yeah.
Yep.
So,
Again, we're holistic.
yeah.
It's not just one single thing. Everything's going to work together. So diet, exercise, fluids,
Yeah.
sleep,
Sleep.
fun, laughter, all of it.
Everything plays a part.
Yeah.
Yeah.
That's really good.
Yeah.
Love
yeah.
that.
So,
Love that.
that's my goals. Do you have any goals for 2026?
So 2026, joyful and grateful.
Okay.
That's been really, helping me get from one thing to another.
I like that.
I do a lot of stuff behind the scenes, as you know. You know that.
Yeah.
I want to laugh a little bit more
Okay.
just because I'm so focused on some things that I forget to laugh. So I
Yeah.
think that's important. Yeah, I'm still working on my own personal health as well. Yeah, I can't cure asthma. I live in Florida,
hard.
and I have 3 dogs.
Right.
I can't cure it, but I want to manage that a little bit better. Yeah, so I do want to strengthen my own breathing. So I'd like to get back into swimming. That's something that I was really good at and I really enjoy. So I know that'll help my respiration a little bit more. Yep. And I think for me, I take on a little too much, so I get really stressed out and I'm really hard on myself too. Because I want to do 100% in everything that I say yes to.
Yep.
Or 110%. Like 99 is not enough.
Right.
I have to put in at least 100%. So I have to remember that I'm only human, not Chat GPT, AI robot, not yet. So, but yeah, I think, I want to continue to be the best that I can be for my patients.
That's amazing.
Know what the latest research is, what the latest trend is, and meet more people, because as I meet more people, I learn more of what the need is in the bariatric space, in the weight management space. So I'm still pretty active.
That's amazing.
Yeah.
Yeah.
That's for sure.
And you also have your goals set out for you too. So I'm sure that keeps you motivated. And trying to make sure you hit everything. And
Oh, yeah.
Yeah.
That's important to me.
Yeah.
Definitely important to me. So I'm really looking forward to our next podcast and really educating more and touching upon more topics of interest.
I'm excited for that too because, we always come with deep topics here. So I'm super excited for us to be able to keep exploring that, touching lives.
Definitely.
And seeing what can come from this too.
Yeah, but thanks for educating me. And really supporting the community. I know you're really genuine and you're living it. So Thanks for allowing me to walk with you in your journey.
Thank you so much for
Yeah.
being a part of it and
Ah,
just touching so many lives that you touch.
it's a
And
privilege.
keep on doing amazing things. I know you're behind the scenes. I'm in the front end, but you
Mhm.
know we still work together as the best team.
Absolutely. Absolutely. Thanks,
But
Corey.
thanks so much, Dr. Love.
All
I
right. We'll see
appreciate
each
it.
other again soon.
Yes.
All right.